So hello, my name is Michael Lichtenberg from Arnsberg Vascular Centre. I'm interventional angiologist here in Arnsberg, Germany, west part of Germany. And it's a pleasure to be here and to report today on some of our trials. So the data we're going to present during LINC are the 2-year data of this real-world registry. And the very impressive aspect of that presentation and the registry is that we included more than 500 patients from more than 40 sites in this registry, analyzing the safety and efficacy of that stent in the daily routine. So we will provide real-world data from patients with very complex situations. And I think that is important to learn about safety and efficacy of a stent. Yeah, so this registry is a prospective multi-center observational study which aimed to evaluate the BioMimics-3D stent in patients with peripheral artery disease in a real-world setting. So beside of technical success, so procedural success, we are presenting data on the primary endpoint, 30-day safety endpoint, and very important, the primary efficacy endpoint, 12 months analysis will be presented. And we also going to show subgroup analysis for patients which are treated with drug-eluting balloons and the BioMimics-3D stents, and also patients which were treated just with plain old balloon angioplasty plus this BioMimics-3D stent. And these data are very interesting to see how this stent performed in these both subgroups. So this 2-year data interim analysis showed us that we included very complex patients, sicker patients with longer and more complex lesions. So we have a very relevant population for a contemporary registry. The 1-year freedom from clinical driven TLR at 1 and are very impressive in terms of patency rates and reinterventions. So after 1 year, the loss of primary stent patency, the freedom from loss of primary stent patency was 88%. So quite impressive as after 12 months for this very complex lesion group. And after 2 years, we are still in the high 70s. So this is very interesting. And the other aspect was, and I think this is the most important aspect, that there was no difference between drug-coated balloon angioplasty plus stent versus non-drug-coated balloon angioplasty plus stent. There was no significant difference in terms of freedom from CDTLR 2 years between these groups. And I think this shows how effective this stent really is. So this is a stent based on the existing data we have so far, and also based on the registry in patients with femoropopliteal disease from proximal SFA till popliteal segment. And it seems that this stent especially works very well in complex lesions, including very calcified lesions and long lesions. So this stent is a unique stent because it promotes a swirling flow. And this concept of swirling flow in comparison to a straight stent seems to work very effective. And this is proven not only by this registry, it was also proven in the IDE trial and first-in-man trial. So it seems that the story behind this stent, the swirling flow effect, is definitely what drives efficacy in this stent system.